All right, hello and welcome everyone. I'm Maria Argos, the Associate Dean for Global Health at the University of Illinois School of Public Health. Thank you all for joining us today in recognition of Earth Day at our Global Health Speaker Series. Our discussion moderator today is Dr. Peter Orris, who is an active member of our Global Health Program faculty and a professor of environmental and occupational health sciences in the School of Public Health. So Peter, I'll turn it over to you to introduce our exciting speaker program today.
Thanks, Maria, and thank you to the Global Program for hosting this for Earth Day. And thanks to Gary and Charlotte for joining us. Just a reminder, we're recording this for posterity and apparently also making a transcript just in case you have a desire for a more elaborate bio than I found on CPA for Charlotte and Lincoln for Gary, which I won't take a long time on because most of this session is going to be your telling us who you are and why and wherefore. What we hope to do in the session is to describe the development of healthcare without harm, the international NGO that is concerned with greening the healthcare sector, why, when it developed, and talking with these two founders of Healthcare Without Harm and really the strategic brains behind its development and a variety of other things, as you'll hear. I will put in where these things generally begin slow, and then toward the end of the hour, we never have a chance to explore all of the interesting questions. I will throw in questions if it slows down or if they're talking about something that I don't want to hear about and want them to talk about something else. Now, that's never terribly successful, I should tell you, but we'll try it anyway. Meanwhile, anybody on the line who wants to put in a question as we're going along, put it in the chat, and I will masterfully put it into the general discussion. And we hope to leave sometime at the end after we ask them for their estimate of the current moment for both public health and environmental health, and for their advice as to where we ought to be thinking about going in the next year and what will be important. So let me start with Charlotte. Charlotte Brody is a registered nurse, vice president of health initiatives at Blue Green Alliance, and national director of Healthy Babies, Bright Futures. Now, this is one of those, these two are presentations that recollect what was said about, that Tom Lehrer said about, I always get the wrong one, but I think it was Mozart. And that is, it's humbling to note that when Mozart was his age, he'd already died 2 years before. So these CVs are very difficult to sit and understand that this is one lifetime we're describing. So she is also a founder of the Campaign for Safe Cosmetics, Green for All and Safer Chemicals, Healthy Families, a registered nurse, mother of two, served as organizing director of Center for Health Environmental Justice, Falls Church, Virginia, executive director of Planned Parenthood in North Carolina, no mean trick, and a coordinator of the Carolina Brown Lung Association, excuse me. Gary Cohen is co-founder and president of Healthcare Without Harm. He continues to serve in that role as this organization, you will hear, has developed to become a major force internationally. He's a member of the International Advisory Board for the Sabimla Clinic in Bhopal, India, which provides free medical care to the survivors of the Union Carbide, now Dow, gas disaster in Bhopal. He is the author of many articles and books, and he was awarded the MacArthur Genius Award in 2015. He has been awarded a Champion for Change for Climate Change and Public Health by the White House a couple of years before. He was also awarded the Skoll Global Award for Social Entrepreneurship, which hopefully he will try to define for us sometime during this hour. And that are our two quite notable interviewees. Let me start with Charlotte. Did you, and he's father of already an adult daughter as well. That was Gary. I left out the family, always do that, right? So Charlotte, did you, where did you grow up? Why did you get into this stuff? Did you start from the environment and work your way to other issues, or were you an activist who decided that the environment was a place to go, with your activism?
So I grew up in Detroit at a time when Detroit was a booming city. We had school facilities and parks that my own children didn't have the equivalent of. I'm the child of Holocaust survivors, of immigrants after World War II. And I didn't start as an environmentalist. I really think I started as somebody who wanted to protect my parents. So I couldn't stop what happened to them, but the civil rights movement was beginning, and people were being picked on and needed to be defended. And that was something that I wanted to be part of. And I was very lucky that in Detroit, there was an office of the Student Nonviolent Coordinating Committee, SNCC, run by two extraordinary women, Martha Cosell and Dorothy Dewberry, who took me in at 16 and let me observe important discussions going on while I typed thank you notes and balanced checkbooks and did other things, picked up food, and did the other things that a 16-year-old could confidently do. And it's all gone from there. I as you said in my long bio, slightly embarrassing, I did other things before I worked on environmental health. And it was really the work I did as a director at Planned Parenthood in just as we were beginning to recognize the threat of HIV/AIDS. And the response in the healthcare community was, we should burn everything. Table paper, pee cups, right? We poured the pee down the drain, but we should burn the pee cup. And the Planned Parenthood uses a lot of pee cups during the day. It was what we were being asked to do to protect our patients that I learned was actually harming the environment that led me towards the environmental health movement and to get to work with Gary and you on Healthcare Without Harm.
Gary, same question.
Yeah, I mean, interesting. Charlotte references her Jewish roots. I also was deeply influenced growing up as a Jewish boy in the first generation after the Holocaust. And the mantra in the Jewish community was never forget that this happened and never let it happen again. Never let people be made expendable at the altar of racism or nationalism. And that had a huge impact on me. And interestingly, when I got out of college, my first job was writing guidebooks. So restaurants in Paris and walking tours and pubs in London and the best cannolis in New York. And at some point, after some travels in India, I came back to the United States, and a very close friend of mine said, Gary, you're a guidebook writer. Why don't you write a guidebook to toxic chemicals? And I said, what do you mean? He says, well, there's all these communities around America where people are facing toxic chemical threats. And I said, well, I don't know anything about that. He said, you don't have to. Go talk to these folks. And I did. And so what I learned is that they were mostly moms and dads sitting around kitchen tables wondering why their kid had some rare form of cancer, why their daughter woke up choking at night because the air was so bad, why they had skin lesions on their bodies after taking a bath. And they knew that it was some polluting factory or incinerator down the street that was causing these problems. They had no political power, they had no money, they had no technical expertise, but they were fighting to defend the health of their kids. And I was so moved and inspired by their tenacity. And I thought, this is what it looks like in a modern day where people are made expendable. And in the industry, in particular, the petrochemical and fossil fuel industry, built its business model on externalizing harm to people and planet. And so I felt compelled to get involved in the environmental health and justice movement 37 years ago. And so I'm still doing it.
And your graduate work that you did, was that derivative of this research? So I have two questions. Why did you begin to do it, and why did you drop out after a year?
My graduate work was actually in South Asian studies. And so I was interested in Indian philosophy and mythology. And I was particularly interested in two concepts that was very present in particular Buddhist philosophy. One was this sense of interconnection, interbeing, that we are all completely interconnected with each other and nature, which is a very ecological concept at bottom. And two, that in that sense of interconnection, one should operate from a place of deep empathy and compassion. So those were influential values to me as I then entered into the movement work. The reason I came back was actually, it had much more to do with a woman that I was in love with. And I came back to Boston from UC Berkeley to marry her. And that's when I got engaged in this work in a deeper way. And I was also deeply influenced, because you mentioned this clinic in Bhopal. I was deeply influenced by this chemical disaster that happened in 1984 in December, where a Union Carbide pesticide factory blew up one night in this town in Bhopal, and killing thousands of people in one night while they slept in their beds, and injuring 500,000 others. And I got very involved in trying to address the health issues that they faced, intergenerational health issues, as well as trying to get the company responsible for this disaster to be accountable. Union Carbide, and then, as you say, it was bought by Dow Chemical. And I saw that basically they didn't care about these people. It wasn't on the balance sheet for either of those companies. And to this day, 37 years later, that factory has still not been cleaned up. It's still leaking chemical poisons into the neighborhood. People are still having health impacts. The company Dow now is considered a fugitive from justice in the Bhopal courts. So the accountability to what I think is this morally bankrupt industry is something that I really feel it's crucial as a citizen of the world and as a good Jew to fight against that way in which people are being made expendable.
And Charlotte, really the same question. Did you become a nurse first, or did you become a nurse to increase your credentials in the health system as you began to be involved in the movement that you described? Or did you become a nurse to make a living?
I became a nurse because I needed a way to make a living. That seemed like a reasonable thing to do. My first foray into higher education was in Far Eastern studies. I learned Chinese and studied Confucianism and the Vietnam War and haiku poetry. It was all very academic and delightful. But an undergraduate degree in Far Eastern Studies can get you a desk job at the CIA and not much else. And I didn't really think I was cut out for a desk job at the CIA. So I worked with GIs coming back from Vietnam. I worked on an underground newspaper in Boston, and realized I had no way of making a living. And of all the things that I could do, that I thought I would be interested in and that I could do well and make a difference, becoming an RN seemed like the best of the choices, so that's what I did. And I went to a really interesting RN program that was full of LPNs who had been doing RN jobs without the licensure for many years, and now we're going back to school to get the degree to match their skill. So it was a really important experience for me to learn from mostly women of color who had been doing this work for a couple of decades and knew what they were doing and taught me. And I also learned that there were things that I was good at. You know, at a time when nurses still calculated the medication. I know I sound 1,000 years old, but we really used to do that. And I'm good at math. So I became the meds nurse, and they taught me how to make an occupied bed and how to actually take care of a human being in that bed.
So we've set the stage, and it's the early 80s, and the two of you are kicking around in one area or another. How did you meet? Why? And who was sitting or in the room where the light bulb went off about healthcare without harm, and why? And then why don't you guys just talk about the development of healthcare without harm, where it began, and where it's developed over the last 30 years, 25, 30 years. Positives, negatives, mistakes made, reorientation, or whatever. And just why don't you back and forth? You're much better than if I intercede. So whoever wants to take it. Whoops.
Yeah. Should I start, Gary?
Please do.
So I was working for Lois Gibbs, a woman you all may know from Love Canal, the mother of Superfund, as her organizing director. And I got a phone call, I think, back in the days when we used to do phone calls, from Richard Grossman, a very good man, asking me to meet this guy, Gary Cohen, who was coming back from India. And we met in an Indian restaurant with pink tablecloths. Very pink tablecloths, very odd. And I think that for me, healthcare without harm seems like a pretty good idea, because the work I was doing with Lois Gibbs and activists all around the country who were working on toxic chemicals through the Center for Health, Environment, and Justice, there were a lot of people who were doing very good work locally, but had the common problem of challenging an enemy that wasn't available locally. So the power of their work didn't address the target that needed to change. And the only sort of solution that seemed open was, well, you go to work for a national environmental organization, right? Because then you're more in the seat of power. And that wasn't the right solution. So I was thinking about, we were talking about how could there be a national effort that had the power to be effective with local common targets that let people stay where they were and build power locally, but be effective because it was connected. And everybody has a hospital. So that made a lot of sense to me. that it would give people a way to stay where they were, be connected nationally, but work locally on a target that could change because of local power. That was one piece. And then the other piece that made sense to me is, I went from Planned Parenthood, which is a whole other webinar we could do, and saw what could happen when you had national power, to the Center for Health, Environment, and Justice, where it was pretty clear to me that we were up against a chemical industry that had a whole lot more power than we did. That we were a speck on their screen. All of us together were still a speck on their screen. And I was thinking about, and I think this is something Gary and I actually talked about that first day, we needed to move other sectors away from the chemical sector. We needed more sectors on our side. And the idea that the healthcare sector, full of people like you all who want to make people better, that could be a sector that we could cajole away from the chemical industry, especially since there was plausible deniability, which we can talk about more later. So that's how I remember the story.
So there was I'll add some more pieces, which is that when I did come back from India, there were two things that were happening scientifically that were really important. One is that we were learning about that chemicals could act on our hormone systems. They were endocrine disrupting chemicals, and they could be impacting the child in the womb in the first 1,000 days of life. They could turn on and turn off genes and disrupt the normal development of a child. So the idea that the dose makes the poison was actually being refuted. It was really the timing. At tiny, tiny amounts of chemical in those critical windows of development could have profound impacts on disease later in life. And at the same time, and two of the chemicals that we were learning about, one was dioxin, which was produced when you produce chlorinated pesticides, the production of them, or PVC plastics, and then when you burn it. So that's one thing. And then we were learning about mercury more, and mercury as a neurotoxin, especially toxic to the developing brains of children. And at the very same time as that new science was emerging, the Environmental Protection Agency reported that medical waste incinerators were the largest source of dioxin emissions in the United States and a significant source of mercury emissions. So we organized, Charlotte and I, a couple of different meetings of different constituencies at a place called Commonweal in California. So there were breast cancer activists, there were endometriosis survivors, there were religious leaders, there were environmental justice leaders, there were a whole broad set of folks, doctors and nurses, a few. You were one of them, Peter. And in those conversations around this new science, around environmental health and toxic chemicals, the fact that the healthcare sector was itself a large polluter just was this light bulb going up. So we have to get this one sector that has healing as its mission, the one sector in our economy that lives by this Hippocratic oath to first do no harm, to understand the connections between the environment and people's health, between chemicals and people's health, between ultimately climate and people's health, food systems and people's health, buildings and people's health. And so we said, we need to, as Charlotte did, we need to pull them into an understanding, because they're not necessarily committed to using toxic chemicals. They're not committed to using fossil fuels if you can show them safer alternatives. From the very beginning, we said, we're not going to blame this industry. They're just not educated. Doctors and nurses don't go to medical school or nursing school and learn about environmental health issues. Incredible. Now it's changing, but it wasn't certainly then. And we're gonna work with them to basically detox their buildings, their supply chain, their food, their energy, and model what an economy looks like, what a sector looks like that doesn't externalize harm, that doesn't create injustice or health impacts along its supply chain, because it's about healing. It's about health. So that was also the real impetus behind it. And I remember thinking, okay, we'll close some incinerators and we'll get rid of mercury, and then we'll move on to other stuff. And we had so much uptake. We had so much enthusiasm for these kinds of changes, and achieved huge victories early on. Early means like 10 years early, but still took a while. But we completely eliminated the market for mercury in the United States with almost no policy. It was all in the marketplace and shareholder activism and wrestling the American Hospital Association into a partnership with the EPA and the American Nurses Association, and getting all the hospitals in America to move away from mercury. When we started, there were 4,500 incinerators right next to pretty much every hospital. In 15 years later, there were less than 100. And we taught the sector how to reduce waste, how to recycle, how to reprocess, how to use alternative treatment technologies. And people said, wow, that was incredible. What's next? And then we said, well, we got to keep this thing going, because there's this appetite inside the sector to build a movement for sustainable healthcare, to build a movement for healthier communities. And so it grew from there.
Yeah, but just, I love that Gary remembers it as a lovely slope. I haven't been along the whole slope, so just to say to people thinking about, but they had it so, the work I'm doing must not be good work because it's not going as easily. I remember that the first retail pharmacy that we got to eliminate mercury fever thermometers, we found out that the reason they did it is they were about to be indicted for selling cigarettes to minors. And so they were looking for some minors, MINORS, right? And so they were looking for something good to take away from the bad. And that was a disaster, right? And I remember Mayo Clinic accusing us of trying to take away mercury sphygmomanometers, which were the state of the art in measuring blood pressure, and that millions of people were going to die from hypertension because of the terrible thing we were doing to mercury sphygmos. When the American Hospital Association called the Pinkertons to provide security, because I don't know what they thought we were going to do at their annual conference, but that we were going to bring incinerators, burn inside of their meeting, right? So that they hired 100 Pinkertons at the Washington Hilton. So there was, like every change, at the beginning people tell you you're out of your mind, and then you blink, maybe you blink 10 years later, and everybody agrees with you. And often they don't even remember that they ever went crazy because you said incinerators spewed. Remember, we almost lost a meeting because we wanted to use the word spew. So there was a lot of resistance, but we, as Gary said, it was important that we didn't blame. I think that's actually important in all healthcare, right? That people don't do good with being blamed, right? You shut down, you become defensive, and you lose the chance for change. And I think we did a really good job of starting with incineration to say that all these incinerators were built at hospitals thinking that they were the best thing to do for public health. And now we were learning that wasn't true because of dioxin and mercury, and so it was time to change. And I think that plausible deniability actually was really important. And with mercury, that we used to think that if you weren't seizing because of mercury, it was okay. We didn't understand low-level exposures, especially prenatally, and the harm that they could do. And like lead, right? We didn't understand that small exposures could harm. And now that we understood that, we needed to make changes. And I think that for a bunch of crazy kids, we did a good job of not of creating a set of science-based arguments about why things needed to change, and giving healthcare professionals and hospital administrators a path to doing that.
Not only them, but it was also trying to broaden the ecosystem to create innovation across the entire enterprise of healthcare. So in other words, when we started, they were still serving, Pepsi and Coke and donuts, to patients. They're still with McDonald's in the lobby of hospitals. There was a complete disconnect between the kind of modeling healthy environment you're trying to create and then the food that they were serving. Hospitals were buying, and still in some cases are, buying meat produced with the overuse of antibiotics. At the same time, their clinicians are deeply concerned with antibiotic resistance. And so making those connections was really important, because then it activated a whole set of dietitians and food purchasing people to say, hold on, we can do better than that. We can actually use our purchasing power to support more racially diverse, sustainable growers in the regions where we operate. That's going to create jobs. It's going to model a healthy and food environment. We can link that to food as medicine initiatives. We're able to activate architects saying, hey, can you build cancer centers without carcinogens? Can you build children's hospitals without chemicals linked to birth defects? Can you create healthy environments that actually promote healing, as opposed to having the buildings be on life support? And I think that motivated and activated a whole set of architects to design what became the Green Guide for Healthcare. So I think part of the strategy has been to build a movement inside of healthcare, that healthcare of the harm was the Intel chip inside of healthcare to help activate this incredible innovation that now has, grown all around the world. There's people working on this kind of agenda in 75 plus countries around the world, more. World Health Organization, the United Nations Development Program. Now the federal government is committed to decarbonizing the healthcare system. And as you say, did we build hospitals with fossil fuels to run them? Absolutely, that was what we knew. But now the science is telling us that fossil fuels are killing people and making the planet uninhabitable. So we innovate, we move away from fossil fuels, we move toward renewable energy, we address the supply chain, the toxic plastics, the overuse of pharmaceuticals and their incredible life cycle. We start to create energy efficient MRIs, a whole set of innovations across the entire world. I mean, we had no idea it was going to grow so much when we started. And Dr. Orris here, he's sitting back, he was one of the great evangelists and ambassadors taking this vision around the world into so many different countries.
And I think, Gary, one of the important takeaways from what you said is that there are people spread across healthcare around the world who saw the opportunity to live their values and to remember why they ever wanted to be part of healthcare and make it so, right? To deepen the connections between what they thought about when they went to bed at night and what they did in the middle of the day, and to be one seamless person. And we gave lots of people, Healthcare Without Harm gave lots of people the opportunity to step into that truer self, as you did. And I think that's been a big piece of what has led to this success.
Yeah, and I think even an expansion of that is not only helping them to transform their institutions, their hospitals, their ICUs, greening the operating room, all of that, but also to leverage their voices as respected messengers in society, as truth tellers, to say this is really the truth related to climate change and health and fossil fuels and health and toxic chemicals and health, and to become advocates in society. I mean, every year the Gallup organization does a poll. They say, who do you trust the most? Nurses, top of the list. Doctors, pharmacists, right up in the top 5. So leveraging that trust in society to change the narrative around what are we talking about in terms of climate change? Is it really about polar bears on ice caps? Or is it really about your kid's asthma? Is it really about the lack of tree cover in Black and brown communities? Is it really about the diesel truck routes that run through people of color neighborhoods? Is it really about where the petrochemical and fossil fuel industry is located in Cancer Alley in Louisiana? It's much more about people's health, and healthcare professionals can be those messengers to say, it's about your health, it's about your kids, it's about your community. And when you talk to people about that, about things that they care deeply about, they're much more likely to act. And so I think we now in particular have this incredible responsibility to leverage that trusted voice to change policy in this country, to change people's mindsets, to break the log jam between this polarized way in which we're seeing climate as some boogeyman that's going to destroy the economy, when in fact it's going to protect the health of billions of people on this planet. Nobody is immune to the extremes of climate change that are now unfolding around the world. So we've expanded the mission of healthcare. It's not just about healing individuals, it's about healing communities, being partners in healing communities and healing the planet. We can't go back to just healing individuals because we've learned that access to healthcare is maybe 10 or 15% of why somebody might stay healthy. But so much of it has to do with the conditions upstream in their housing, in the pollution, in the violence, in the food systems, in the institutional racism. That has a lot more to do with it. And then the environment that's impacting all of us. So it's the mission of healthcare has to change fundamentally in the 21st century. And I think we're on the cutting edge of helping to define and articulate that vision.
Let me take you back, if I could, to the early 80s and the transition of this and practical aspects for people who are looking at this, who are graduate students, who have some skills, who may be in an activist group in their school or in their community. How does that transition to this kind of a mega global organization that partners with UN agencies and the World Bank and a variety of other major players? Both funding wise, how did you begin to structure the group as it began to open up, and how did you begin to make that transition from the neighborhoods to national to international?
No, you go ahead.
Well, one thing that we did, and this was Charlotte's brilliance, was to say, we're going to distribute the money to the people who are doing the work. And so at the time I was the chief fundraiser, but we would give money to nursing organizations. We'd give money to breast cancer groups. We'd give money to community activists that were trying to fight incinerators in Detroit and Cleveland and Oakland and elsewhere. So it was very distributed. It was an ecosystem model, a network model before people were talking about that's how you do systems change. So that was one. And and so there were many different things where we were, and Charlotte led this effort to support nurses. What was it called? The Luminary Award. So we were telling stories and elevating nurses who were doing individual work in their facilities, in their communities, to try to say, look, you can lead from any seat. You don't have to be the head of a national organization. Where you find yourself in, you can lead. And I think that's the message we want to convey to those in medical school, nursing school, and graduate school. It was so many times that it was one person who did something really innovative and interesting. It was one woman at Beth Israel Deaconess in Boston who said, I get this idea about the mercury. We're going to have a Mercury Awareness Day where everybody can bring their mercury thermometers in, and we'll give them a digital one in exchange and some education about mercury. Who knew 15 years later that would lead to a global treaty, right? One person taking action. It was one anesthesiologist in Oregon that said, you know what? One of the anesthetic gases we use is called desflurane. It's 2,000 times more potent than carbon dioxide. It's not more effective than the other anesthesia gases. It costs more than the other ones, and it has this massive environmental footprint. So why don't we switch? That's now led to an entire movement in this country to eliminate desflurane as an anesthetic gas in surgery. All this has come about from some innovative people, wherever they find themselves, making a change.
And talking about Charlotte's brilliance, taking those good ideas, often your own, but also others, and conceptualizing them into a strategy, into an educational campaign, so that those ideas can spread the way Gary says. Do you want to talk some about those initial steps? How do you move from a good idea in one operating room to a national movement?
Well, I think one of the things that we were lucky enough to do is to be very careful about the science, right? And to be thoughtful distributors of the new science, as Gary was saying about endocrine disruption and about low dose effects and the importance of timing, and we had some really good members of this distributive network who were just excellent researchers and scientists, and who helped us write good papers. When C. Everett Koop, remember C. Everett Koop, who did an editorial in the Wall Street Journal calling us Health Scare Without Shame, which is really very clever. Our science on phthalates was better than his science, right? We had done a more thorough job of describing the then emerging science about, phthalates being a weak carcinogen, but being a DHP, the phthalate in medical devices, being a very potent endocrine disruptor. And it was Ted Shetler going to Baxter, then as now, a very large provider of medical devices. And Ted's science was better than the Baxter scientific presentation. And again, there was one person at Baxter who heard us and who pushed the company, with the help of all of the women religious that had lots of stock, to start considering the importance of making IV bags out of something other than PVC, phthalate plasticizer. But I think that the fact that we were respectful of the science mattered, and I think it also mattered that we sometimes had the European Union and sometimes had EPA. That there were sometimes we had the California Department of Public Health, but that early on we had validators that made us seem a little bit less crazy.
We weren't crazy. We also had luckily enough, the first two healthcare systems that joined our efforts, one was Kaiser Permanente, which was the largest integrated health system in the country besides the Veterans Administration. And two was Catholic Healthcare West, that now has become a Common Spirit Healthcare. So for a long time, we had these two really important health systems. If we were a rock band, we would have been called Kaiser and the Catholics. But over time, we expanded that group. And so now Practice Green Health, which is our sort of membership partnership scaling division in the United States, has over 1,400 hospitals as partners. That's 25% of all the hospitals in America. And that's growing as there's more momentum around the world and in the United States to address climate as a health issue. And that the healthcare sector, being almost 10% of greenhouse gas emissions in the country, needs to be leading the effort to decarbonize. So, the other dimension, I think, is building this kind of peer-to-peer networks where other clinicians, other nurses, other hospital administrators could talk to each other and say, how did you do that? What was the business case? What was the innovation you did? And working with the supply chain, what companies were really innovating to serve up furniture without flame retardants, without perfluorinated chemicals, without formaldehyde. So by creating that aggregated demand and peer-to-peer learning across many, many hospital systems across the country, we also created the momentum to influence the supply chain that didn't require policy, which is very hard to do given the power of the fossil fuel and petrochemical industry. We still see that today. But creating this sort of demand from billions of dollars of purchasing power has also been a way to move the agenda and to support innovation despite the capture of our government in many cases by this industry, which is pretty much unregulated.
So
I think that we were and are really smart about not playing favorites with vehicles, only and knowing what we wanted to do. So the places where we could ban mercury fever thermometers by law, Ann Arbor, Michigan being the first of them, right? That was good, fine, right? Like where we can move it legislatively, fine. Where we can move it in the market, fine. Where we can move it in what group purchasing organizations are willing to feature and not, fine. That we didn't confuse the means with the end, and we're willing to use every available, whatever was going to work to get us to less mercury in production, less mercury in use, less mercury in babies' breast milk. We were agnostic, eclectic about how, as long as we got there.
could you each comment perhaps, and this comes from a question in the chat, the democratization of the World Wide Web and communication that has occurred over the last 20 years, where almost anybody sitting on their back porch can talk to the rest of the world. How did that impact on what you're doing? What do you think? Often we handle that poorly. Often we shake our hands because, or rub our hands because it provides an avenue for demagoguery and for quote unquote false science and false news. How does this new platform of democracy at that level, what are the opportunities for us and for you with the healthcare without harm and other environmental issues?
I'll go. So one thing it's allowed us to do is to expand the knowledge and innovation across multiple continents. So if the Swedes are doing incredible work about pharmaceuticals, well, let's learn from that. You know, what does sustainable healthcare look like in rural Africa? It looks very different than it does in the United States. It looks like solarizing thousands of clinics and having solar refrigeration so you can keep vaccines cold when there is no grid or when there is no reliability to the grid. So it's allowed us to build a global ecosystem, which is crucial. It allows us to share the science and to raise up innovation that's happening anywhere around the world. And it allows us to have a collective voice. So in this recent conference of parties of the climate treaty in Glasgow, there was a call to action letter that was signed by organizations, 500 different healthcare organizations, health organizations, representing 50 million health professionals around the world. It starts to help us build a global movement because these issues are global. Chemical exposure, global. Climate, absolutely global. Antibiotic resistance, global. So it has enabled the globalization of movements.
Oh, I mean, you mentioned, Peter, the internet also is a place of fake science and fake news and fake fears. And, you know, I appreciated what Gary said about the importance of healthcare without harm as a way of telling an environmental story through the power of how it impacts your health, your family's health, your children's health. And I think that's all true, but it's been honestly terrifying to me to see the use of masks become a political issue, and the idea that drinking bleach is a way of dealing with COVID, and all of the ways that we've seen in the last few years a pandemic become a way to divide people's politics, and this most recent decision that we shouldn't wear masks on airplanes because of a judge who really doesn't have much background in science or law, and it in a way, healthcare without harm and environmental health and justice are, at its core, a way of taking our most personal fears and hopes and turning them into what needs to happen in an economy, what needs to happen in a culture, what needs to happen in a country. And I worry, at 6 minutes left in this phone call, that we aren't doing everything we need to be doing to challenge this division, this political division that has turned into irrecountable differences about what public health means.
So let me give you both time to wind up, if you will, and preach to us or the rest that may be young graduate students looking for a way to be relevant and to further have a satisfying life and make a contribution. At the same time, family and moving ahead. And maybe you can even sneak in a little Blue-Green Alliance within that, but not everything. So you're on. You two can finish up. Bring us home.
Well, you know, it is the economy, stupid, and it always has been and always will be. And the work I do with the Blue-Green Alliance is about really thinking through how do we build a new economy? How do we rebuild manufacturing? Manufacturing is how low-income people become middle-class people, and the loss of manufacturing has been especially hard on Black people in the United States, and even how do we rebuild a chemical industry? You know, I know Gary's making the face. We don't have pharmaceuticals if we don't have chemicals. And is there a way, if we're really thinking, is there a way to think about how do we not think that the answer to Cancer Alley in Louisiana is somehow to turn it back into sugar plantations, right? It's about could we redesign the way we make stuff so that you're happy to be a neighbor to a facility and you're happy to work in that facility. It's a safe, healthy place making safe, healthy stuff. And I think that's the challenge before us, is that it's not going back to hunting and gathering. It's how do we redesign the economy so it works for people and it provides good, safe, healthy jobs, making stuff we actually need, that is made safe and used safe and disposed of safe. And I think thinking about, for all of the people on this call, thinking about how you become part of that design, not only for the next generation, but for the generations to come, is what we're called to do, both to address climate change, but also to address the economy we want to live in a less climate-threatened world.
Building on that, I would say look, the only possible economy in the future to make the planet livable, to build equity, to build sustainability is an economy that's built on renewable energy, it's built on green chemistry, it's built on sustainable agriculture. And that's an economy that can create justice and health all along its supply chain, wherever it operates. And in order to have such an economy, we need to ensure that the way that the current economy runs, which allows industry to not fully internalize the full cost of the damage it's creating to the environment, to people's health, that has to stop. That's one of the key factors we need to do to redesign, is that those costs have to be borne by the industries that are polluting people and hurting their health. And we now know that fossil fuels kills more people than AIDS, malaria, and TB combined around the world. And so at the end of the day, it's a fundamental struggle about whose rights are going to prevail on this planet. Is it the rights of our kids to be born toxic free and to have clean air and clean water and healthy food to eat? Or is it the rights of the fossil fuel and petrochemical industry, which at the moment is committed to the continued strategy that they've been operating under? So to me, I'm sticking with the kids. And I think that there's enormous room in where people are organizing in their future employment, in their role as citizens of the planet, to be involved in that movement to defend our children and to defend a future that's possible. And so, we need young people to take on whatever work we've done and to take it to the next level and innovate ways in which we haven't even thought about yet. So I'm hopeful. I find myself being incredibly hopeful when I see all these young people with such passion to help heal the wounds of centuries and to help build the future together.
Well, that's pretty good.
Starting with your local Amazon and warehouse and Starbucks. Like, everybody matters.
So we thank you both very much. We thank you, Maria, for hosting this session as part of the Global Health series. And we assure both of our participants that the transcript will be delivered personally to Senator Manchin and other old people in Washington. So thank you again.
Yep.
And thank all of you for spending the morning with us.
Thanks, Peter.
Bye-bye.
Bye.